Hey everyone, Dr. Charlie Johnson, physical therapist and back pain specialist. If you're watching this video, you've likely gone through my step 1, the self Q&A to healing your own back, and that exercise that I had you do at home. And in that exercise, you likely still have a little flag drawn in the corner of your paper that has nothing next to it because I forgot to explain what it is. So this video is about red flags if you have lower back pain. So what are red flags? Red flags are basically the elephant in the room, okay? So you know, if you have lower back pain and you were to come see me and or another healthcare provider, we're asking questions to make sure that you're appropriate to be treated by us, okay? And or that you're appropriate to be treated by us, but maybe you need some more workup because we're concerned about some other things. Or we're concerned enough to just say, hey, I'm not so sure we can help you. We need to send you elsewhere for further imaging or medical treatment, okay? So red flags are important before you move on to self-treatment. So you just want to ask yourself some questions, and if at any point you have questions about or become really concerned about your lower back pain, or you have a lot of these red flags, you're going to want to chat with a physical therapist and or healthcare provider at your, as soon as possible, okay? So again, as a physical therapist, I offer a mechanical solution to a mechanical problem, meaning when you come see me, I always have two sort of decks of cards in my brain, okay? And I'm always kind of putting some on top, taking one, moving it to the bottom, and prioritizing what could be going on with your back, all right? And on one end, in one deck of the cards, in one hand, there are a list of mechanical problems. So I'm thinking, what could this be? Is this a disc? Is this a problem with the joints? What is this, okay? What type of mechanical problem is going on? Is it the way you're moving? Is it the way you're doing things in everyday life? Is it a certain way that your muscles are working or not working? Is there stiffness? Is there weakness? Whatever it is, they're very mechanical problems that I, as a physical therapist, can change. In the other deck of cards, there are some red flags and or some other diagnoses that I can't help, okay? These are the big and ugly things, usually cancers, things with your vessels in your belly and that go down your legs, and other diseases or problems that I can't help, okay, and that I would need to refer out for, okay, that are more serious, all right? So this video isn't made to spook you in any way. It's just the reality of just being thorough with asking yourself questions and making sure that you take care of yourself and you take these precautions, okay? Keep in mind that very little back pain is caused by serious conditions, but say 1 in 100 can be caused by something big, ugly, and scary, okay? So let's just review these things and check these off the list before we get moving, okay? So these are the elephants in the room. You want to ask yourself these questions. Do you have these signs and symptoms or these issues going on? Now keep in mind, having just one of these isn't usually a big deal, but if you start to notice that you have multiple of these issues, then you're going to want to get checked out by a healthcare provider, okay? All right, so red flags, the elephants in the room, okay? So one of the questions you should ask yourself is one of the questions that I ask people is there anything else that seems completely unrelated to your lower back pain that you have going on? It may seem, again, just like I said, is there anything else completely that you perceive to be completely unrelated to your lower back pain that you have going on? Okay, so this is a great question to ask yourself and to be asked by a healthcare provider because it looks at you as a whole person. So this is a big picture approach. And really we want to know, sometimes I treat people, with their back pain and I ask them that, and then they start talking about how, they have had a death in the family and how that's really bothering them. And we find out that that's actually playing into the back pain that they're experiencing. So it can be anything, but is there anything else that seems completely unrelated going on in your life or in your body that you think I should know about, okay? So with that being said, do you have any other weird stuff going on elsewhere, all right? And here are some of those things, okay? So do you have loss of bowel or bladder? So are you unable to completely relieve yourself of, urine, or do you have constipation? Do you have, or are you wetting the bed, all right? So loss of bowel or bladder control, okay? Do you have numbness or tingling like right around your buttocks region. Okay, so this is something to think about. All right, do you have, again, this is very common, but do you have night pain? And you might be saying, yes, I do. Should I be concerned? Well, do you have night pain that is so bad that you can't reposition and go back to bed? All right. So is the night pain, it just wakes you up no matter how you sleep, no matter how you move. It's just unrelenting pain, severe pain that you just can't go back to bed. Okay. So do you have night pain so severe that you can't go back to bed? Do you have, and this is probably the most important question, do you have a previous history of cancer? Previous history of cancer predicts future cancer, all right? So if you've had it in the past, you're more likely to have it in the future. And in the case of back pain, we want to make sure that the cancer, or that a cancer, is not the cause of your lower back pain. Again, not super common, but can happen. So if you've had a previous history of cancer, something to consider, and or just keep an eye on, okay, if your back pain is not improving. You have unexplained, so that's the key. Unexplained weight loss or weight gain. So there are some people that say, yeah, I've had weight loss, but I've put myself on a diet, or I've exercised more. Well, that's normal, right? You would expect and or you would hope for that, right? But some people also come and say, hey, Charlie, I haven't done anything, and I've lost 30 pounds in the last few months. So that's a flag, okay? You should be throwing up a flag to that. That should be something to keep an eye on, okay? Unexplained weight loss, weight gain, night pain, cancer. Do you have a pulsing sensation in your abdomen? So does it feel as though your back pain is throbbing and that you have this kind of pulsatile feeling in your belly? Well, there's a big artery, an aorta, okay, or your aorta, that runs in your belly, and sometimes this can cause back pain, all right? Do you have fever? Sign of maybe an infection. Do you have night chills or night sweats, chills, things like that? Do you just generally just not feel well? Maybe have nausea, okay? Things like that. That seems to coincide with your lower back pain, okay? And or, if you're a female, do you have any changes in your menstrual cycle or anything abnormal there that seems to correlate with your lower back pain? Okay, so these are all signs that don't really mean anything to 100%, but these are all signs that when you start to put them together, you start to wonder maybe if that other deck of cards, things that maybe warrant other interventions, could be actually causing your back pain. Again, taking one of these, if you have one of these, take it with a grain of salt and keep an eye on it. If you start to say, yes, I've had a history of cancer, I have terrible night pain, I'm losing control of my bowel or bladder, I'm losing weight, and if you have, say, 3 or more of these, then you're going to want to get checked out by a healthcare practitioner as soon as possible. Otherwise, if you don't have these things, then you're likely okay to move on to the next step, which is we're going to determine, we're going to talk about sort of the different classifications or categories of back pain that you may fit into, okay? But at any point, guys, if you're watching this video, girls as well, obviously, you're really concerned about your back pain and it's just so severe and unrelenting, and or it's progressively worsening, okay, that could be another thing here, then please see either a local physical therapist and or a healthcare provider as soon as possible. So stay tuned for video 3, or I guess step 2.